When I was a lot younger, my mom got diagnosed with brain cancer. There was a lot of aches and pains in her body. I was a lot younger back then, and there was no way that I had any knowledge or experience to deal with that. But that's what I want to give back. I decided to come to this Accelerator course because I wanted to obviously learn more about what adhesion was, how I could help potentially fix that in my clients. No words, inspirational, highly knowledgeable, extremely experienced. What amazing humans. I am 110% full focus on Adhesion Release Method. I am a remedial massage therapist from Australia. Revitalized me massage. I had come across Dr. Chris Stapien online on Instagram. You know, there's a lot of practitioners out there that, you know, we work on soft tissue, we work on, you know, ligaments and tendons and all of that. But it seemed that there was a gap between manual therapy and then people going straight into surgery. And so after following him and learning what he does is fixing those adhesions so that people don't go into surgery. It seemed to make sense in my head. I decided to come to this weekend. I had signed up to Dr. Chris Stapien's program in terms of learning how to become an adhesion release provider. And so this Shockwave weekend was part of becoming an adhesion release provider. So this is my first weekend, and there'll be many more weekends where I'll pop in and learn off him. That's my main goal, is to make sure my clients feel better. You know, I'm not just rubbing them down and making them feel temporarily great for the hour that they're in there with me, but ongoing relief from pain. Coming from a massage therapy background, we don't deal with nerves at all. Like, it's all soft tissue. So having that additional knowledge and merging the two, it just makes absolute sense in my head that there is adhesions that lay on the nerves that, as manual therapists, we can get rid of to help people with pain. Because, you know, a lot of the shooting pain and all of that, it makes sense that there's like adhesion, congestion, all in that area. This weekend, being able to palpate and feel that was just mind-blowing for me.
Had you ever felt a nerve before?
Absolutely not. Yeah, and to think that we could feel something like a nerve through someone's body, that was a huge learning curve for me, and it was mind-blowing and amazing. When I was a lot younger, in my, you know, late teens, my mom got diagnosed with brain cancer, and prior to that, there was a lot of aches and pains in her body. I lost her when I was 21. Looking back now, as, you know, someone that's nearly approaching the age that she was, I sort of think I wish I was around to help her, you know, just to relieve some of that pain and relieve, you know, the discomfort that she was in. Obviously, you know, I was a lot younger back then, and there was no way that I had anything, any knowledge or experience to deal with that. But that's what I want to give back. That's the root cause of why I changed careers, you know, halfway through my life, to be able to give back to people who are in pain. I was in business development.
Wow.
Yeah, corporate. So 180, completely different. I used to go to work, you know, get into the office and be like, oh, it's Monday morning again, another day, same thing. But now, after every client, I am absolutely like revitalized and joyous and pumped, and just the energy that I get and the passion that I get from helping someone, that there's no amount of money that you can put on that. Dr. Matt and Dr. Brandon, wow. No words. Inspirational, highly knowledgeable, extremely experienced. What amazing humans with so much knowledge, so much, you know, care, passion, depth of wanting to help people.
And what about Dr. Chris?
He is absolutely the same as well. Like, his passion in helping people, his love, and, you know, you can just see when you meet all three of them, the root and reason, like the depth comes from the heart of why they're in this industry, why they're doing, and why they've chosen this method specifically. That's all you see beaming from them is their passion to just help people recover, and that's so inspirational. I am 110% full focus on Adhesion Release Method, for sure.
What are you looking forward to bringing to your, you know, you go back to work on Monday or Tuesday or whatever it is, your first day in the offices. What are you looking forward to bringing to that first patient that you can use this technique to help?
Mindset shift, you know, that they're not coming in for a rub down. you know, a nice feel-good massage that they're going to feel good in the hour and that's it, but a mindset of coming in and absolutely eliminating their pain. And so they can walk away in multiple sessions feeling better at the end of that. And they don't need to come back and see me after that. Ideally, the end point is to make sure that the client feels good and they can move on with their life. If you want to really help people out of pain, I've been in the industry for a few years and there's some great techniques out there, but they're Band-Aid fixes. And after spending the weekend here, I can really see the difference in just one or two techniques, one or two passes, and feeling it on myself, how that shifts the pain in our own body. Just learning of the three of them has been phenomenal. Like to have someone like any of those three in your corner as a therapist, as a doctor, oh my goodness, what a blessing, you know, to have the knowledge, the experience that they have, the passion that they bring along, the things that you learn, the things that you walk away with. You know, I've done a lot of like different external educational courses, and it's been nice to, you know, have a different perspective. But coming into Adhesion Release Method, it is a complete mind shift in terms of how to treat people, how to look at the client, how to prepare them for the treatment, you know, the process of treating them and the curiosity of trying to figure out what's wrong with them, as opposed to a lot of other modalities where you just go in and, oh, I've got neck pain here, I'm gonna rub your neck. Being able to learn how to find out what the root cause of the pain is, and then being able to treat that, just the mindset change and the different way you learn how to look at a client and how to help them is completely different from what I've ever come across. Yeah, if you're on the fence, just do it.